Our final competency is examine the impact of common psychological disorders on relationships. My intention with this section is to give you a basic awareness of mental health disorders, how they may affect relationships, and some awareness to watching for disorders to occur and when and where to seek treatment. There's 200 disorders classified in the DSM-5, and those fall into 5 major categories. The DSM-5 is the book that we use to diagnose mental health disorders. It gives us the criteria and the symptoms that are common for all of the disorders. So clinicians really use it kind of as a tool to help see where people might fit in terms of their symptoms, and then with that knowledge, then we know possible methods for treatment. So I want to today kind of talk a little bit about how that occurs and how mental health really can affect relationships. So if we look at this next slide, we see that our who we are as human beings is not just a body. It's not just a personality. It's not just kind of our soul, but we really are intertwined in that body, soul, spirit components. So those pieces, those parts of who we are always interconnecting with one another. And so if we're sick, if we have a cold, we may be feeling kind of down in the dumps, and it might affect our social life, or it might affect our work life. The same is true when we talk about mental health issues, that when there is something that's falling in the mental health realm, that doesn't just doesn't affect our psychology, but it may also affect our body. It might also affect our spirit and our soul. So with this, then you can see that our relationships are part of that, and that whenever we are sick or off balance, our relationships will tend to have an effect or tend to suffer. The reason why we talk about mental health disorders is because about 80% of the people will experience some sort of diagnosis, usually depression or anxiety, at some point in their life. So with that high of a rate, chances are at some point in your life you will either be diagnosed yourself, have somebody that you love be diagnosed with a disorder, or be working with somebody who is having a disorder. So it's really good to be aware of what is available and have an understanding of that. We're going to focus today on two categories: depression or mood disorders and anxiety, and because those are the ones that are most common in being diagnosed in our society. So why do mental health disorders occur? And we tend to look at what we call the biopsychosocial model. So bio meaning biology. Very many of our disorders, almost all of them, have some sort of biological impact or genetic start. So if you have somebody in your family who has anxiety, for example, you are at a greater risk for also developing anxiety. We do see a lot of genetic components in that. We also see psychological components. We know that people with depression tend to have a more pessimistic worldview. They tend to see things more negatively. So sometimes our thought processes will either contribute to a mental health disorder, or they might be a symptom of a mental health disorder. And finally, the social piece. as I stated before, our relationships are affected. And so when we have an illness, that may affect our relationships. And also, some of our relationships might contribute to an illness. So having unhealthy relationships, bad communication, being in domestic violence, those types of relationships might contribute to a mental health disorder. We also know that some disorders tend to be situational, especially when we're talking about depression or anxiety. Some are brought on by postpartum depression is brought on by the birth of a baby and the biological changes that occur with that. Seasonal depression tends to occur for most people at this time of the year when the days get shorter and people have a more sensitive response to the amount of light that they're experiencing. And so some people will kind of go into a depression in the winter, during the winter months, and then that will lift some in the spring when the days get longer. So we can see a variety of different causes, and the hard part is that they're all intertwined. And so it's oftentimes hard to kind of tease apart what is the exact cause. But knowing the cause, knowing kind of where it stems from, helps us in terms of where we go as far as treatment. So to talk about mood disorders is one of those major categories, and major depressive disorders and bipolar disorders fall under that category. So if you think about mood disorders, think about your mood as being on a continuum, and you can see the continuum here with normal kind of being in the middle. So most people have a normal mood. Your mood doesn't stay the same every day, all day long, but you kind of fluctuate. Most people will kind of fluctuate in the middle area there. Euthymic means just kind of not real, kind of in between happy and sad, just kind of content. So that's that middle one on the that middle square right here, euthymia. And then we could look at our moods from going down to one part to the lower part of our continuum, where we tend to talk about depression. So we have severe depression where there might even be psychosis. Psychosis is the loss of reality, when you lose touch with reality. To the other end of the continuum, when we talk about mania, mania is kind of like a very high elated feeling that's not drug induced, typically when we're talking about this area. It can also be seen as anger. So mania is here on the other end of the continuum. Also, you could have psychosis or the loss of reality on this. When we talk about people who are depressed, we talk about their mood staying on this left half of the continuum. When we talk about people having bipolar disorder, we talk about people who, if you look down on the screen line, they experience a range, or they cycle through the different disorders. So that is kind of how we look at how you can think of bipolar disorder. So depression tends to be the major diagnosis of mood disorders. And so you can see here the differences or the symptoms that occur when one has depression. So not all of these symptoms must occur to meet the diagnosis. You need at least 6 of them, and it needs to be for at least a period of 2 weeks. Okay, so continuous for 2 weeks. When we look at appetite and we look at sleep, we're really looking at changes in our appetite and sleep. So some people will be really hungry, want to eat all the time, or some people will lose their appetite. Same way with sleep. Some people will not be able to sleep. They'll have insomnia, or they'll want to sleep all the time. So the key here is we're looking for a change from the regular routine. Okay. So one of the misconceptions about depression is that all we feel is sad. But as you can see, um, it's more complex than that. So there might be kind of this soup almost of negative feelings, negative thoughts that people will express. And teasing apart some of that makes it a little bit more complicated when we're looking at treatment. So when we treat depression, it can be treated in two ways primarily. You can use medication, our SSRIs, our serotonin reuptake inhibitors, our medications such as Paxil, Prozac, Zoloft, and there's a whole gambit of newer ones even, that help to not make you happy, but they help to change the chemistry in your system so that it's more balanced. They change the serotonin use in your system so that the biological part of your depression will lift. The other thing we can do is psychotherapy or counseling to help people kind of correct negative thoughts, thoughts that are not healthy thoughts, and also to help look at relationships and situations that might need kind of fine-tuning. Anxiety is the other disorder that people will tend to get. Again, too, this is not like just in one area or situational, but oftentimes it's carried through for several weeks. Sometimes people's personalities might lead them more to anxiety. They might be a more type A personality, which will lead them to having more anxiousness. The pinnacle of anxiety, not everybody has panic attacks, but panic attacks may occur in an anxiety disorder called panic disorder. And a panic attack feels much like a heart attack. So oftentimes people who have panic attacks might present in the emergency room thinking that they have had a heart attack, and they find out that it's indeed panic. But nevertheless, it is an awful feeling to have. So how do we seek help? As you can see, that it's a pretty complex list of symptoms. And how do we know when we're getting help? Well, I think the one thing is paying attention to that feedback, paying attention to your body. We just talked about being mindful in the last competency, and really kind of seeking treatment before you get on the ends of those continuums. So you can seek treatment in a variety of ways. We have oftentimes in our rural areas, there's less resources, but nonetheless we can get you guided to different ways. So going to your primary physician might be the first place to start, because that's the person you know, and talk to them. You may also go to every community has a mental health agency. So in Southwest Wisconsin, our mental health agency is Unified Counseling Services. If you live in Crawford County or some of the counties that have human services, then their agencies, their mental health agency is embedded in their human service program. The last one is the EAP programs. Oftentimes, your workplace will have an employee assistant program that will connect you with counselors. It's a third party resource that will connect you with counselors. Sometimes they offer legal aid and different things to help support that wellness in the workplace. So there are avenues. Sometimes it's a little bit hard to navigate when you are out in rural areas. Resources are a little bit slimmer for things, but starting with somebody you know and you trust, and really being persistent will help you to get that treatment need. The last thing is overcoming the stigma to